Hi, I'm Mélina Khansari, a student in biocomputational engineering at the University of Maryland. Today I will be presenting multimodal radiogenomic prognosis of non-small cell lung cancer. The leading cause of cancer death in the United States is lung cancer, with non-small cell lung cancer accounting for 80% of lung cancers. Due to late diagnosis, most NSCLC lead to poor prognosis, where over half of people diagnosed with lung cancer die within 1 year of diagnosis and less than 18% survive after 5 years. The usual way to diagnose a tumor is to perform a biopsy to remove a small amount, which can be intrusive. This is an example of an invasive technique. Unfortunately, most non-invasive techniques yield insufficient samples, resulting in inconclusive diagnosis. Computed tomography and positron emission tomography are regularly used to do prediction with the help of statistical modeling and machine learning approaches to reduce the high dimensionality of radiomic features. Radiomic is a promising subfield of machine learning. It assesses genetic mutation in lung cancer following a non-invasive approach. My research question is, can radiomic phenotypes of EGFR mutated NSCLC and machine learning methods aid in predicting and prognosticate NSCLC in patients? Positron emission tomography and computed tomography radiomic phenotypes combined with mRNA in non-small cell lung cancer are associated with patient survival, but as said previously, those methods are not enough. We would like to see the survival performance of the NSCLC patients using machine learning algorithms like t-SNE and Cox survival analysis. Epidermal growth factor receptor is a protein made by the EGFR gene. Mutation in this gene can cause that protein to grow too much, which can cause cancer. Studies have shown that EGFR expression in NSCLC is associated with reduced survival. Therefore, targeting the EGFR represents a promising molecular approach in cancer treatment. EGFR inhibitors have introduced the concept of targeted therapy to the treatment of non-small cell lung cancer. In mutation-positive individuals, treatments with an EGFR tyrosine kinase inhibitor, TKI, has been demonstrated to be more effective than standard chemotherapy. Here's the workflow of this study. We first started by segmenting and extracting 431 radiomic features from CT and PET images. The 3D segmentation of the tumor was performed on 130 non-small cell lung cancer patients. This was done on the software ITK Snap. We then used the elbow technique to calculate the optimal numbers of radiomics in lower dimensional space, which was 5. t-SNE was used to reduce dimensionality from 431 to 5 radiomics. Then we perform statistical analysis to determine the concordance between the t-SNE radiomics with the clinical data using the Cox survival analysis model. This is our clinical data composed of 130 patients that have NSCLC with 73.8% male and 26.2% female, ranging from 43 to 85 years old when first identified at histological diagnosis. There were former smokers, current smokers, and non-smokers in this study. 79.2% have survived, while 20.8% did not. In this study, we chose an unsupervised approach that tested a dataset of 130 NSCLC patients to help increase the probability of an accurate prognosis. The optimum number of low-dimensional representation to use for t-SNE was 5 thermomics. The feature level was lowered from 431 radiomic characteristics derived from tumors on CT and PET images to 5 radiomic signatures. These 5 thermomics helped us visualize our data better, but also contributed towards the prognosis of the survival states of the patients and the classification of their survival rates. t-SNE captured the structure of the datasets so that neighboring point in the input data tend to be neighbor in the low-dimensional space. The purpose of this approach is to find similar probability distribution in low-dimensional space. On the screen, we can see 4 graphs corresponding to t-SNE 1 on the x-axis and the 4 other t-SNE on the y-axis. To understand the previous graph better, I added a regression curve to each graph. I also added this projection of t-SNE, which is a better representation of all the t-SNEs together. The Cox models were trained to predict the survival rate of non-small cell lung cancer using the reduced size extracted thermomics generated by the t-SNE. When comparing the age with the survival status, we performed a z-test, which showed 2 features were significant: t-SNE 5 with a p-value of 0.01 and the time to last follow-up with a p-value less than 0.005. Cox regression modeling of overall survival for the NSCLC dataset yields a C statistic of 0.63 with a 95% confidence interval for the model comparing the survival status with the age. The Cox regression model of overall survival for the NSCLC dataset compared to the gender had one significant p-value of 0.04 for the de-identified age at histological diagnosis, but the concordance increased to 73% with a 95% confidence interval. The C statistics and the p-values show the success of t-SNE. The hazard ratio shows that t-SNE 1 and 5 are below 1, so the event hazard decreases and thus the duration of survival increases. Since the hazard ratio is less than 1 for those 2 t-SNEs, then the predictor is associated with improved survival, while t-SNE 2, 3, and 4 have a hazard ratio greater than 1. The predictor is associated with increased risk and decreased survival. This figure shows the Kaplan-Meier curves of survival prediction for the age at diagnosis, which revealed no significant differentiation between high and low-risk patients using extracted radiomic signals. The p-value is then 0.37. This figure shows a Kaplan-Meier graph of the survival probability as time goes by, with males and females being compared but showed no significance with a p-value of 0.69. This figure demonstrated a Kaplan-Meier curve of survival prediction, which revealed a minor difference between old and young patients using extracted radiomic signals. The p-value is on the verge of being statistically significant at 0.065. Here again, a Kaplan-Meier curve of survival prediction is shown, which revealed a difference between the smoking status with a p-value of 0.16. There were 3 smoking statuses, hence the 3 curves which showed non-smokers, current smokers, and former smokers. The primary aim of our study was to prospectively evaluate methods better than CT and PET imaging to predict the mutation status in lung cancer. CT scans and radiomics are not accurate enough. They only show generalized image features which lack specificity to EGFR mutation. Radiomic characteristics taken from a region of interest beyond the tumor are crucial to considerably reduce the death rate of patients with non-small cell lung cancer. Machine learning methods can help with the prediction of NSCLC for radiomic analysis. In this study, the main methods used was t-SNE. The 2 lowest p-values of the t-SNE are t-SNE 1 and 5, in which t-SNE 5 is statistically significant. They had a hazard ratio below 1, so the event hazard decreased, and thus the duration of survival increased. Tisney was therefore successful at predicting the survival of NSCLC. The study showed that combining radiomic phenotypes, clinical factors, and unsupervised approaches improved the prediction of NSCLC as well as EGFR-targeted therapy outcomes. This combination helped identify NSCLC patients likely to benefit from targeted EGFR inhibitor therapy. Future research will focus more on the direct connection with the EGFR inhibitor and its correlation with the survival status of NSCLC patients. The presence of EGFR mutation can be better accessed through predictive machine learning models. Future work can also involve a greater set of low-dimensional representation methods to enhance the accuracy of the NSCLC prognosis. To conclude, this study tested the Tisney methods while concording it with the clinical data to increase the accuracy of the prognosis of non-small cell lung cancer. Our results corroborate previous evidence regarding the efficiency of unsupervised methods to predict NSCLC. Therefore, EGFR mutation status and radiomic features are directly associated. This association can be used to boost the prognosis and prediction of non-small cell lung cancer. Here are some of my resources, and thank you so much for listening.